We often think of a surgical procedure or a particular medication or set of medications as a cure. But what I want to emphasize, even though these things can be helpful, they're really maybe adjuncts or perhaps maybe temporary treatments that should be used only as an adjunct to the patient's overall care.
I'm presenting Mr. Cayenne, 75 years old man, gentleman, with a medical history of significant type 2 diabetes, hyperlipidemia, hypertension, and peripheral artery disease, and atherosclerotic heart disease. His condition was initially diagnosed following a cardiac catheterization done December 2023, revealed severe coronary artery stenosis, and as a result of this, he underwent coronary artery bypass surgery in February 2024. Patient mentioned that post-operative, he had an episode of atrial fibrillation, and he subsequently placed on multiple medication for everything: diabetes, atrial fibrillation, hyperlipidemia, and hypertension. The primary reason for his visit is that he's experiencing chest pain and palpitations, even after the bypass.
The chest pain he's experiencing now, is it the same as the chest pain he had prior to surgery? Or is it worse? Do you know, that he give any ideas?
So he's still having like similar chest pain, but not like the same intensity as before. But he has been told that the chest pain probably due to other blocked arteries.
So he's having pain, it's just not as bad. So there's some improvement?
Yes.
Okay.
So the main thing that he want to improve his arterial health and to prevent further complication or heart issues. The initial labs or test we did here revealed high cholesterol levels and some inflammatory markers, which is consistent with arterial blockages.
Interesting. So let's stop there. So this patient, 75-year-old man with diabetes, known heart disease, underwent bypass surgery approximately a year ago, and his symptoms may be a little better, but not really. In fact, he may require a new problem since surgery. The atrial fibrillation may be a new problem. Certainly it's post-operative fib. We don't know if he had atrial fibrillation prior. Maybe he had mild AFib that wasn't severe, but maybe it's just a new problem. But you have a situation where a patient starts with a complex problem: diabetes, inflammatory disease, atherosclerosis. There are probably other issues too, but the bypass surgery addressed the atherosclerosis to a certain extent.
Yeah.
But it's only a mechanical treatment. But despite that, this patient, after surgery, is still having these symptoms, still having atrial fibrillation. His cholesterol is still elevated, and his condition probably isn't significantly better. But here's a situation where someone has diabetes, atherosclerotic coronary disease. Despite having bypass surgery, you still have coronary disease that probably can be fixed by bypass surgery. So the problem really wasn't fully addressed, if it was addressed at all. That was my take on it. So cholesterol is elevated, increased inflammation. Anything on vital signs that was problematic? Or
Nothing significant. The blood pressure is like controlled with medication, as he mentioned. His hemoglobin A1C was controlled also, it's like 5.7, but the patient still have like the complication from long-standing diabetes, like neuropathy.
So you're still having symptoms of neuropathy. How many medications was he on?
He is like on 2 medication for the diabetes, 2 medication for the blood pressure, and other metoprolol for the atrial fibrillation.
We did a heart monitor. He didn't have any AFib, but it was like more of a post-op AFib. So he actually didn't present to us on Eliquiz, just on like antiplatelet therapy.
Gotcha.
Before he came to our clinic, he had gone to the ER after the bypass for another angina episode.
Okay.
And they told him, you still have other lesions that are moderate to severe. And they said there was still some inflammation even in the the bypass graft. So he kind of wanted to know what else could he do to improve circulation everywhere in his body.
Yes, and even the inflammatory markers that we did slightly highlight the NT-proBNP, which is a marker. Usually it's elevating the coronary artery disease. The other marker or enzyme is the LPPLA2, which is an enzyme associated with the vascular inflammation. So both of them were elevated, like reflecting that this patient still have vascular disease.
Yes.
Inflammatory.
So I would say this patient's coronary disease really wasn't treated. What would you say? I mean, he had bypass surgery, but I mean, he still has angina. He still have, active coronary disease with the symptoms and inflammation. So he had, or certainly not complete treatment of the atherosclerosis. I would argue it wasn't effectively treated. Maybe he bypassed a few vessels, he improved flow a little bit, but this is inadequately treated atherosclerosis. What dietary regimen did his other team have along?
He didn't mention any dietary, so the risk factor is still there.
Yes.
Like diabetes, the high blood pressure.
So he was still on a standard American diet?
Yes.
Okay, so no nutritional recommendations or anything like that. Okay. So have we started treatment on him yet, or where are we with our treatment?
Yes, he was seen by several of our colleagues here. And so they started him on the meal plan, the detox. So he's done 2 weeks of that. And then I saw him after that. And so the chest tightness, he was having that 3 times a week with exertion relieved with rest. That's gone now. I stopped his glipizide, which is a diabetes medication, so that we would prevent hypoglycemia. And then stopped one of his blood pressure medications, hydrochlorothiazide, because his blood pressure was doing well and he, didn't have any edema or anything like that. And then I also recommended a few other things like the infrared sauna therapy, which helps improve nitric oxide production, improve circulation, and vasodilation of your blood vessels. And then also recommended the IV plaque X infusions, because some studies show that helped reduce the plaque buildup in the coronary arteries. I explained that the cornerstone is the diet, so that's why it's great he already got started on that. And so he does live out of state, so he's kind of coming back and forth a little bit. So part of the thing we'll have to work on is really being consistent and having follow-up with his condition, because he also has quite severe lower extremity disease too, even though that's not the main symptom problem.
Is he able to come and spend some extended time with us?
Well, he's been here 2 weeks. He's gonna have to go back home for a week and figure some things out with a family and personal issues. He likes coming here, and when I mentioned how much other things we could add, he's gonna try to work a way to come and stay more consistently for a longer period of time.
Yeah, at least 4 weeks to get ECP therapy as well.
Right.
Of all confusions aside. And the treatments we're talking about, starting with the nutrition, is where we're treating the body systemically. The nutrition, as Camille says, is the cornerstone because it's an anti-inflammatory regimen. Now we have different nutritional regimens for different patients, different conditions. He's like a raw detox anti-inflammatory regimen. We make adjustments in this based on the patient's individual needs. And this decrease the inflammation in all likelihood. It probably decreased the coronary spasm. That's likely why the angina subsided. The diabetes, of course, our studies show during this nutritional regimen, hemoglobin A1C comes down, diabetes better controlled. We also know that with improved nitric oxide production from the nutrition, the leafy greens, that can also help the blood pressure go down, so he's able to decrease the medications. So the issue of polypharmacy becomes less of an issue. And so this is how you treat someone like this with not only coronary disease, but he has, inflammatory disease, he has diabetes, diabetic neuropathy. And this approach is one where a patient like this should start at this regimen And had I seen it initially, I would start this approach prior to taking them to surgery. I'm not saying you wouldn't have had to go to surgery. I'm just saying you want to start with this approach. Why? All right, start this approach first. Let's say he actually needed surgery, okay? At least he had a regimen or something where he needed surgery. I would still start with this approach first because the nutrition decreases inflammation. Decreased inflammation will help improve the surgical outcome. Because when you make a surgical incision, you're increasing inflammatory markers. Okay, that's a vulnerable plaque in the artery could, ulcerate. You have a heart attack on the table. That's been reported. It's not unheard of. Post-op atrial fibrillation is likely due to the increased inflammation from surgery. So post-op AFib, I think, is probably triggered by inflammation because they use drugs like colchicine to help suppress it with anti-inflammatory properties. But if you go into the surgery with an anti-inflammatory nutritional regimen, you likely decrease the risk of that. So a 2-week intervention like this prior to surgery, even if you need surgery, I would say would have been beneficial. And let's say, for instance, hey, tried this for 2 weeks and got much better, you could continue indefinitely to determine whether or not you needed surgery. So it's this type of approach we like to take. Unless surgery is an absolute emergency or angioplasty an emergency if someone's at the throes of a heart attack. Most surgeons don't operate someone who's at the throes of a heart attack anyway, but they need emergency stent, etc. That's another issue. So it's a great clinical case because it shows how this broad approach is really the definitive approach, and you can really see this approach compared to surgery, how the patient overall got better. The surgery didn't get better, improve his diabetes, but the nutritional intervention did. The surgery didn't improve his coronary disease or symptoms, but the nutritional intervention did. The surgery did not improve his blood pressure, but the nutritional intervention did. And in all likelihood, over time, the nutritional intervention will likely help the peripheral neuropathy side as well as prophylaxis disease. The surgery won't do that either. Any other thoughts, comments?
I mean, I agree. I think the nutritional aspect, it improves circulation everywhere. Surgery is targeted, maybe bypass a native blockage, but in this patient, it didn't alleviate his symptoms of coronary artery disease completely, and that's why he came here, because he recognized that too, which was good.
Yeah.
Also, maybe because they approach the high blood pressure, diabetes, and the high cholesterol only with medication. And right now, the medication itself, it has like side effects and everything. So right now, when we start the diet or the nutrition might help decreases, like, as you mentioned, the polypharmacy, so it can improve the quality of life.
That's right. And that's the key point. The quality of life is very important because if he's taking for your medication for your side effects, he's going to feel better.
Yeah.
And these lifestyle changes can be easily integrated. I mean, people can change their lifestyle. You can change how you eat, the way you eat, recipes. It may take time, but this is an easier thing to integrate than have to take medication that are making you feel bad all the time. If you're feeling better, it gives you more incentive to make these integrated changes.
Thanks for watching. If you got value out of this video, please like it, subscribe, and hit the notification button to see our next show.